Welcome back to the Winback Academy podcast, where we bring together clinicians, educators, and experts from across the Winback community to explore rehab, recovery, movement, and patient care in the real world. I'm your host, Ramona von Leyden, PhD, Winback's Senior Director of U.S. Medical Affairs. Today's episode is part of our Ambassador Spotlight series. Conversations focus less on protocols and more on the people behind the practice, the experiences that shape them, the lessons they've learned, and the philosophies that continue to drive their work. Today I'm joined by Melanie Carminati, physical therapist, owner of Inspira Physical Therapy and Pilates, and Winback Women's Health Ambassador. In this conversation, we talk about women's health, pelvic rehab, chronic pain, movement, patient trust, and the evolving future of women-centered care. We also discuss what it means to create spaces where patients feel heard, supported, and empowered throughout the recovery process. Here's my conversation with Melanie. Welcome, everyone, to another episode of the Winback Academy podcast. I'm your host, Ramona von Leyden, PhD, and today we continue our Ambassador Spotlight series, which is conversations focused on the people behind the practice. These episodes are about more than clinical techniques. They're about the experiences, philosophies, and patient relationships that shape great clinicians and educators. Today, I'm joined by Melanie Carminati, physical therapist, owner of Inspira Physical Therapy and Pilates in Brooklyn, and one of our Winback Women's Health ambassadors. Melanie works extensively in women's health, pelvic rehab, chronic pain, and a number of other things, which I'll let her introduce herself. Brings a really thoughtful perspective on patient care, trust, and helping people reconnect with their bodies through rehab. So, Melanie, first of all, thank you for being here.
Thank you so much, Ramona. I'm really excited to chat with you today.
Yeah, and would love to hear a little bit more as this idea. You've got such a broad and diverse background that if you want to just give us a couple seconds on what you do, that'd be great.
Absolutely. So I am a physical therapist. I introduce myself now as a chronic disease physical therapist specializing in pelvic health, chronic pain, and EDS and hypermobility. So my practice, I have a practice in New York City. We have two locations actually in Midtown and Brooklyn. And my team, we integrate physical therapy and Pilates in terms of a continuum of care for people with chronic conditions like the ones that I just mentioned.
That's incredible. So that leads us very nicely into my first question for you, which is how did you first get into physical therapy and kind of what has led you down this path? Like, did you always know you wanted to work with these kinds of patient populations? That's very specialized, very unique. So I'd love to hear a little bit more of that story.
Yeah. So from a very young age, Ramona, I have been introspective and I have had a journal. And in one of my Polly Pocket journals that I had, they had a prompt that said, my favorite thing to do. And I wrote to help.
Oh my gosh, that's
So,
incredible. I'm not surprised, having
yeah.
to get to know you, that you were always an introspective person. Um, but what an incredible, what an incredible story. Okay.
It's the truth. I mean, I could show you the journal, but
Yeah.
the rest of what's in there, it's quite silly. I don't know for anyone out there who's a journal keeper, if you've ever gone back and read your own journals, but like, wow, really interesting to read my journals from elementary school and the things that I was going through or just writing about.
Oh
But
my God.
it's
Yeah.
yeah, so it's been something that's been in me for forever, as long as I've had that cognition and the recognition of who I was and what my purpose was. So from there, I became a dancer, musician, but always knew that I wanted to help. And there was a time where I thought I was going to go to med school, but after doing some like intensive med school summer programs, as a high school student, I decided that I didn't want to go to med school and I needed to figure out what the other healthcare route was for me. And from observing different healthcare professionals, it was pretty obvious that I wanted to live and work like a physical therapist did because of the relationships that you develop with your patients. It's incomparable. We get so much time with our patients, and yeah, the knowledge that you learn, the things that you study in physical therapy school was all everything that I wanted to learn. So that was my journey. So that's why I
Yeah,
became a physical therapist. Uh-huh.
I think that that's probably, I would imagine there's probably quite a number of people in the PT space who've had that same kind of aha moment, which is med school seems, it's kind of what you're growing up and be like, oh, you want to help, so you're going to become a doctor.
Yeah.
And then once you're actually an adult and going through that process of understanding what med school entails and what your job will look like afterwards, you start
Yeah.
to realize, and not, this is not a shade to doctors at all, but there is an element that they don't have a ton of time, and this is, a healthcare system issue ultimately. But the amount of actual patient-facing time they get, the amount of time they get to, sit down and spend with their patients is just pretty minimal. Whereas PT, like you're really that person who gets hands-on with them. You're the one who gets to really dig in to all the work with them. So that makes a lot of sense to me for someone who, as you said, wants to help. Was there anything? Like as a kid, I'm curious, like wants to help. Was there something that you maybe anything you had seen that kind of piqued your interest on this? Was what was, in your upbringing, were there groups or organizations where you were kind of made aware that there are a lot of people who probably just need to help each other, the help from the community?
Well, I think that first time that I wrote that journal entry, I was pretty little, so I don't know how much exposure I had at the time, but it's just the feeling you get from simple tasks of helping, like helping my mom, helping my dad, helping my neighbor. The feeling, it brought me joy. It made me happy to help people. So,
That's fantastic.
yeah.
Okay, so let's move a little bit further into that. So then you knew you wanted to help, but then at what point did you kind of realize you wanted to work with more specific patient populations like you work with now, like the chronic pain, women's health, as you said, EDSS, these pretty specific conditions?
Yeah. So when I was in my final rotation in graduate school, I had a very fortunate opportunity where I was accepted to a rotation at a clinic that doesn't exist anymore called Polestar. Polestar is still a Pilates school and organization that certifies Pilates teachers, but they used to have a clinic because the organizer, the director, the CEO of Polestar is a physical therapist, a PT PhD who, believe it or not, was a dancer before he became a physical therapist. And he codified his own Pilates method that was very PT mind based about identifying impairments and then choosing exercises based on what you want to address, which is how physical therapists work with exercise prescription. So that was a very fortunate experience for me and really shaped the trajectory of my career after that. I started in outpatient orthopedics and I started doing backstage Broadway coverage as well, working with dancers because I was a dancer and still had the love and passion for dance. Um, but I soon found that where I really got excited and care was actually helping the non-dancers and helping the people who needed more guidance with movement re-education. So it's a different scope of practice when you're working with dancers. Sure, there is movement re-education and re-correcting of compensatory movement patterns, but when you're working with high-level athletes and dancers like that, it's more acute care management for the most part. But I found that I really loved just teaching the non-dancer, teaching someone who had, a chronic this, chronic that, how to get into their body and how to discover their movement capacity and capabilities that would lead to injury recovery and injury prevention.
It's amazing. For our listeners, because I think they'll find it pretty interesting, can you share what kind of dancer, and I know what kind of singer you are as well, and so your performance background?
Yeah, so it's quite a lot actually, and I married a musician. So yeah, I studied like many dancers, I studied ballet, jazz, tap, modern, and then got into salsa dancing when I was 18. And after graduate school, did a little bit of competitive salsa dancing. But in terms of music, I'm actually a classically trained bass clarinetist. I don't know if you know that one.
I
Um,
want to know. Oh, there's another there. Okay, okay.
Yeah. and I sing. And yeah, how I met my husband was actually through flamenco because he's a flamenco guitarist, and I got into flamenco cante during COVID and went all the way and started doing some gigs. And yeah, that's how we met. So,
This
mhm.
is incredible. I think what's so cool with these stories is shockingly, everyone we have who we work with in our ambassador groups it stays busy. Let's say that we've all got
Yeah,
a lot of
yeah.
places we're juggling, but the varied interest and the kind of diverse spaces that each of us get into is so cool. And I think yours is just yeah, it's really unique. And I think being a dancer, as you said, and I think we see this across a lot of people in the PT space, is that someone who comes from an athletic background or and I consider dance to be part of that, is just very aware of their body and is a little bit more aware of those little creaks and aches and pains. And as you said, working with a dancer is going to be very acute care,
Yes.
but what that kind of leads into long term down the line, anyways.
Yeah.
So it makes sense. Let's see, you've kind of Okay, so to kind of wrap up this general background on you, um, you had these experiences, it's kind of led you towards these patient populations. Can you share a little bit about the model that you currently have in your clinic and what brought you to build it in this way? Because I think it's very intentional, and I'd love to hear the kind of thought process behind it.
Yeah. So my practice in New York City, we see patients one-on-one. We work outside of insurance-based models because we want to prioritize quality care and prioritize the patient experience. So because we are seeing people with chronic conditions like chronic pain, pelvic health conditions like endometriosis, EDS, hypermobility, and all of the related comorbidities or overlapping health conditions, uh, we have more of a tranquil space. There's private rooms for treatment. And then we have all of the Pilates equipment. So all of the Pilates equipment is used both in physical therapy for the movement rehabilitation and then also for Pilates privates. And then there's a group class, little studio in the front of the office in Brooklyn. And it's intentional because with the population that we work with, having everything in that one space and having the PT and Pilates team able to communicate and work together for the care and instruction of the clients is really, really helpful and so necessary for that translation of whatever is happening in that patient's body and what's going to be most beneficial for them. And patients come to us because of that, because they know that we're all talking to each other. And even if we need to refer outside of our office for, say, rheumatological workup or other pain management, um, we talk with those doctors. And I generally only work with doctors who will get on the phone with me. Uh,
Yeah, love it. Yeah.
it's like, I know that might sound crazy, but it's hard to come by sometimes. So yeah, that's our integrative care center that we have for physical therapy and Pilates. That's really for continuum of care.
Yeah, I think, I mean, that's really cool to use the Pilates equipment and sort of like you have this very efficient way to use it that it can be both kind of when someone comes in and they have a situation and an issue that they're dealing with, you can use it in as physical therapy exercises and practices. And then, as we talk about the continuum of care, once they've started to improve and get better, you can move them into more like, hey, you can take these Pilates classes, you can maintain, you can prevent further injuries, etc. So I really love that. How do you, because you are outside of the kind of standard insurance model, do most of your referrals come word of mouth? Like, how do people find you?
Yeah, I'd say it's 50-50. 50% of the time it's from like specific healthcare providers or Pilates teachers also, or other care providers like massage therapists, acupuncturists. Yeah, so I say 50% of the time it is that, but the other 50% of the time people are really like seeking us out specifically and looking for very specific care, say for like endometriosis. They want to find a pelvic PT that has a lot of experience or practices a lot of experience and focus on endometriosis. Um, or EDS and hypermobility or chronic pain. So like they are searching specifically for that. And yeah,
Awesome. How long has your practice been around?
8 years.
That's awesome. Congratulations.
Thanks. Yeah.
Um, okay, so you've mentioned this briefly, and I know that you don't consider yourself a pelvic PT, but I do want to get into that a little bit because obviously as a women's health ambassador for us, that's such a big part of it. And let's also I forgot to mention in the introduction that you host an endometriosis symposium and summit every year. So like obviously this is something that's very important to you and you have
Yeah.
a passion for.
Yeah.
So you know, what got you into specifically that space?
Yeah, so I do pelvic floor physical therapy. And how did I get into studying and training in pelvic floor and pelvic health? Like I said, I started in ortho and I always worked alongside other pelvic PTs. And yeah, I just had one colleague who was like, you really need to take a visceral manipulation course. And I'm like, okay. And I didn't know what I was getting into at the time, but I'm so glad I did it because wow, that changed so much for me as a practitioner in terms of my capabilities with my manual therapy and my understanding of what's going on in that abdominal space. And so from visceral, then I went through all of the Herman and Wallace trainings for pelvic floor specific things, but I also went for craniosacral and all of the visceral courses um, as well.
Wow. Frankly, I'm not very familiar with the visceral training, so I didn't even realize that it had so many layers to it.
Yeah, yeah, yeah. So now the two schools, I think they're working together, Upledger and Barral. Those are the two that I studied under. They are now like more or less running their courses coordinating together, but they used to be separate but somewhat associated. But yeah, those are codified methods that are osteopathic mobilization manipulation techniques. So they were codified by doctors of osteopathy. And they are specific, and I use them, and how I describe them is that I use them as nervous system based manual therapy. Although it can be more biological specific if I'm targeting a specific organ like the sigmoid colon or the mesentery, or just working through the sphincters in the abdomen. But all of that, what that does is it does influence your nervous system. So for people with chronic pain, we always want to start with central nervous system based manual therapy. For people with endometriosis and hypertonic pelvic floor and different kinds of pelvic pain, I'm definitely going to get to visceral manipulation with them because that will help to relieve a lot of the restrictions that are influencing some of the pelvic pain. And then people with hypermobility and EDS, I am also using these nervous system based techniques because it helps with multiple things, with the chronic pain, with sensory overload, with yeah, even proprioceptive input, the gentle touch. So yeah, but so visceral cranial, that is actually what led me into pelvic health. And from there, I just dug deeper in the pelvic training, did more bowel re-education, bowel dysfunction courses. Um, and yes, it's was one of those things that like as a woman, the first course I took, I remember I called my mom after and I was like, Mom, I don't think I'm gonna have a baby. I don't think I want to do this. Like I just learned so much about like what goes down and during childbirth that I was scared, honestly. And I have a baby now, so it's all right. But yeah, just like the amount of information that you would not know as a woman unless you are like connected with a pelvic PT or a pelvic PT yourself. It's mind-blowing. There needs to be, I think there is more now, like especially with social media, people are knowing, but and we're like I'm in New York City, so like women are way more like open to these things, but like outside of the city, I know that there's still some women who don't even know what pelvic PT is. Their doctors aren't recommending it. And it is it's a women's health issue, you know?
Yeah.
So yeah, just for that reason, being a woman too, I was like, yes, I'm gonna take all these courses. Yes, I'm gonna learn all this stuff. Yes, I'm gonna help other women. And
Yeah.
um yeah,
Well, and that
it's been amazing. It's been amazing to help women in their journeys, prepartum, prenatal, postpartum, endometriosis, pelvic pain, urinary issues, bowel issues. It's been so rewarding to help people because this stuff impacts your life like on a big scale. So,
yeah, absolutely. I'm going to mention here that Melanie and I, we first met because she was coming on as a women's health ambassador right when I joined the team at Winback, and we met, within my first 2 weeks of being on the Winback team in France, doing the training where part of it was women's health. And I remember because you brought your baby, and I remember us having that conversation in the car where you were saying, yeah, like you've had a lot of the issues that many women experience postpartum that you have a bit more understanding on. So you
mhm.
mentioned a little bit, but what do you think many women are missing when they enter healthcare rehab systems? I think there's an education piece that you mentioned, and it's
Yeah,
changing. There's definitely been, I don't know whether to call it, it's trendy to talk about women's health now, but
yeah.
but it's definitely something that has been missing, and it's still a lapse.
Yeah. Yeah. Actually, I just read a New York Times article about the industry for vaginal health and vaginal care is booming right now. So, good, right? And it was saying like even beyond like cosmetic kind of things, like actual like pain symptoms. And so yes, we're in a great moment. But your question being what, can you repeat your question? The question being, uh-huh.
Of course. And it's like you mentioned this a little bit, is that the things that most women don't know when they enter into healthcare. I mean, even as someone who, you want a baby, you get pregnant, you
Yeah.
had a little bit more of an idea of like what was going to happen down there in all the actual anatomy. But most women who've, even ones who've had babies, don't really understand it to a depth of like what is going on to the tissue and to like what's going to
Mhm.
happen after and the recovery and what that actually means for you long term.
Yeah. Yeah, totally. If like what I wish more women knew and like where the healthcare system needs to give more information is if a woman has a goal and a desire to have a vaginal delivery, they 100%, 1000% need to have pelvic floor physical therapy, like a significant amount before, like pretty much from their second trimester until they give birth. Because there is no other time, especially I'm talking first time moms, especially, there is no other time in your life where you're pushing something out of, I'm sorry, but pushing something out of your vagina, that big. And so you need to prepare the muscles. And yes, there is hormonal changes. And yes, there are physical changes that happen while you are in labor. Totally, 100%. But especially for those people, like if you were a dancer like I was, very likely that the pelvic floor musculature is tight. Or if you're someone who's already having pelvic pain, pelvic floor muscles are likely tighter. If you're having pain during sex and then you get pregnant, girl, you got to go to pelvic PT ASAP, like because you need to get those muscles ready.
What
So,
is, yeah, I think that, man, there's a lot of things in the PT space where I think traditional healthcare has positioned PT as something that happens after you have an injury, after you've been in whatever. But as you said, prehab is just as important as rehab.
oh
Uh,
gosh, yeah.
and in
Yes.
this case, God, that makes so much sense. If women, you go to pre-birthing classes to prepare for what the actual delivery is going to be like, but no one's saying like, okay, how do we prepare your body for what's about to happen? It's
Yeah.
which
Yeah.
any other physical thing, like as you said, you're a dancer, you train, you condition your body. If you're an athlete, you train and condition your body for the activity that you're going to do. So it should be approached the same way.
Uh-huh.
Um,
Uh-huh.
I love that. That's so important. That
Totally.
being said, so I think something with pelvic health, with
Uh-huh.
postpartum things or prepartum, um, we're working in a very sensitive area. So how important is trust and safety? I mean, you talk about your one-on-one with your patients and you really build a relationship with your patients. Um, what role do you think that plays in outcomes in, how people respond to treatment in the nervous system.
Yeah. If the trust isn't established, the patient's not going to get better and they probably won't come back. So, it's such a art and there's nuance to it as a clinician to establish that trust, especially when you're dealing with pelvic floor treatments, because so many of us have experienced some level of emotional trauma, sexual trauma that shows up in our pelvis, whether it's from direct trauma to the region or, external, some emotional relationship-based trauma that then results in symptoms presenting in the pelvis. So being aware and holding space for your patients is something that I actually go over the first day of any of the physical therapists who join the team, and being able to be compassionate. When people come in, if they are someone who has a trauma history or just seems hesitant and uncomfortable about the idea of having a pelvic floor musculoskeletal exam, we won't do it the first day. Maybe we'll do it the second day. Maybe we'll do it the third visit. But it's something, there's nuance to it, and yeah, I mean, sometimes, especially if there's that emotional component and there's some kind of trauma, the patient just might not be ready for it yet. And if they have not been to psychotherapy, psychologists to talk through some of the trauma first and be in a place where they feel really regulated and they have a support system to keep themselves managed and able to manage what might come up emotionally during the treatment, um, yeah, they might need to do that first. Uh, it all goes back to the multidisciplinary nature of pelvic health conditions, of chronic conditions in general.
Yeah. So if you have someone come in, and as you said, you might not do a pelvic exam on the first, what kinds of things would you be able to do with
Yeah.
someone who then that you're like, ooh, they're not ready for a pelvic exam? How would you start that at least helps them to leave feeling like, okay, we've done something to progress towards the goal?
Yeah. So this is where Takar comes in, and this is where some of the nervous system work comes in. But I would typically do some kind of nervous system work because that kind of work, it's such gentle touch also, very light touch, that also develops rapport and trust. But if they are wanting treatment, um, we can work into the abdominal area. And we know with the research that Winback has been doing that working into the abdomen with your hands, and then it gets amplified with the Takar current, with the radio frequency current, that can impact the pelvic floor. We do not have to work the pelvic floor directly. We can work externally first. So that's something that can be really powerful for people to get a little bit of relief, even if we're not able to go directly to the pelvic floor muscles in the first session.
Yeah, and I think that'll definitely be what we'll kind of transition into next is kind of your story with how we came to that. But I do think, yeah, non-invasive approaches, which can make people feel more comfortable. As you said, with the nervous system, focusing on things like the vagus nerve. If somebody's coming in, they might be very nervous to do anything near the pelvis, even if they know that they need it. And so
Mhm.
their, breath work and vagal nerve stimulation can help just down regulate the nervous system so they're a little bit more open to what may need to happen.
Yeah.
Um, so actually, since you brought it up, let's kind of dive into that. As you mentioned, Winback being one of the tools that you use to help non-invasively, but I've heard this story from you, but I'd love if you could share how you first kind of discovered and came to use Winback into car therapy.
Yeah, so I was actually going to another devices course training. It was a shockwave course. And I think the technology is really amazing, but just knowing my patient population and how sensitive they are, um, it ended up not being the right fit for my practice. But the medical rep, I told him, I said, listen, if you find it a technology that is comfortable and I can use it for orthopedic and pelvic health conditions, please give me a call. And then 2 years later, he did, and he put me in touch with Matthew from Winback. And I had a very fortunate opportunity where the IPPS conference was supposed to happen in Orlando, I think, and then there was a hurricane, so they made it virtual, and I was supposed to meet Winback at the conference, but apparently they had flown most of the team up to New York, and Matthew was like, well, can I just bring my team to your office? And I was like, yeah. So I had these world-class trainers, Winback trainers, in my office. And yeah, I mean, I knew instantly just from feeling the technology and trying it and seeing how, as a clinician, it was very easy to apply as well, that my patients were going to love it. And I was right. And yeah, it's been tremendous for getting immediate relief that actually keeps working, so they keep feeling better in that 24 to 48 hour period after we use it in a session.
Yeah. Out of curiosity, who was with Matthew when they came to the practice?
Yeah, I don't remember.
Is it international people?
International Ignacio, maybe?
Oh yeah, Ignacy from Spain. Yeah.
Yeah, I think it was him. He was so lovely and nice.
Yeah, he's great.
One thing that's definitely happened after giving birth and becoming a mom is I don't remember people's names as much, but yeah, I think it was Ignacio.
Yeah, it's funny. When I did my interview with Laura, she was, sharing her story as how she, learned about it, and it was Fred, who's the president of our academy.
Oh, wow. Uh-huh.
It, kind of like you, she worked with the WNBA, and she said, I had this day where I said, okay, everyone who has a modality, come and pitch it to me, like come present it to me. And so she had someone there with laser and shockwave and all these things, and she's like. Everybody came in and then pretty quickly they would leave. And then Fred comes in and she put the bracelets on and she was like, and then I was like, okay, I'm going to give you more time. And they had spent like 2 hours together, just like digging in and playing. And I was like, that would be what a cool way to kind of introduce it. So yeah, similarly to have that experience. And I think that's something that like is so unique about not just Winback, but the Takar introduction to the US, because Takar is traditionally and sort of historically more of a European modality,
Yeah.
that there's this international component, which I love because it brings people together. As you know, we're working, we've applied to like the World Congress next year with a team with someone from Spain and Mexico and you and someone from Hopkins. And it's like, you get this mix of people who are all ultimately working on the same thing because humans across the world all are dealing with very similar issues, no matter where you are. But
Yeah,
you have these different perspectives, which can play into your approaches and learn from each other in such a unique way.
totally.
Okay, so did you have, when you first started using it in your practice, was there anything that kind of surprised you as like, oh, you knew that patients were going to respond to it, but like, was the thing that you're like, wow, this is working really well with my patients?
Um, well, I think the patients, like the patient response and like the enthusiasm for the patients, like they would come back asking, can we use that again? Can we use that to car again? Can we use that again? Um, but yeah, I mean, let's talk about endometriosis. It's just like mind blowing. I'll do like an abdominal treatment because now, we're cleared to be using the device while they're on their period, while they're menstruating. I'll use the current in like my own way with like different electrodes, CET, RET, and they come into the office, their pants barely, like they're so tight, super bloated. They leave, the pants fit and they feel better. So like that's like one of the direct things. So like I have one woman who like whenever she comes in, if she's on her period, she's like, can we use it, please? Can we use
Oh,
to
that's so interesting. Yeah, the
and
kind of
then
question anti-inflammatory aspect of it.
yeah. And then another I guess would be more orthopedic because we see patients with EDS, hypermobility, chronic pain. There's something about this current specifically and its influence on proprioceptive fibers and or just the way that it influences the nociceptors with, pain gating and just that relief that lasts, that they come in asking for it. There's a clinic in New Orleans that one of my patients went to that has Winback, and I believe they chose my practice because they knew we had Winback. So in terms of the EDS hypermobile population, these patients get a lot of relief from their symptoms with this device, and it's instant and it's long lasting. So yeah.
I'm very curious, with hypermobility, I'm not super familiar with kind of the symptoms that they might have and how Winback might help it.
Yeah. So chronic pain is one of the very common overlapping health conditions with these people, as is pelvic venous congestion syndrome, POTS dysautonomia, MCAS, mast cell activation syndrome. So when I was in Paris last year with you and I had asked Aurora a specific question about MCAS, she got so excited and was like dancing. And she had explained to me that she could even manage an MCAS flare, mast cell activation syndrome. So we have mast cells throughout our gut, even in vulvar tissue. And we know that if there is a elevated histamine response, that itself can elevate the pain experience. So if we are able to regulate the metabolism and just like the processing and whatever histamine is present in the body, that can reduce the pain and that can reduce the intensity of a MCAS flare. So
Hmm.
yeah, so there's so many overlapping health conditions in the under the umbrella of EDS and hypermobility that really benefit from the Tachar radio frequency. Pain, um, generalized pain, pelvic pain, um, the MCAS that I mentioned. Um, yeah, and just like that proprioceptive input, the current, depending on how it's used, we could be using it for muscle activation. So getting a little bit of feedback into muscles that are hard for that person to activate. Yeah, so we could use every current with that population.
Wow, that's really interesting. Kind of in that vein, I wanted to make sure in this conversation that we had together, explore a little bit more in broader women's health area. Something you brought up to me and kind of spearheaded me to say, like, hey, let's get on a podcast and talk was
Ah,
a recent conversation around renaming PCOS to PMOS,
yes.
uh, and what that kind of says about how the evolution of how we're looking at women's health care. So, like,
Yeah.
first and foremost, I mean, I know what your reaction was to me, but what was your reaction to that change?
Woohoo! Yay! We're making the name so that it directly correlates to root cause, and that will make it easier for all clinicians treating these patients to give them proper care that helps. So, polyendocrine metabolic ovarian syndrome is the new name. And I mean, I've been hearing this for years that doctors are using certain medications off label to treat PCOS, and it's working. So now it's not going to be off label in time for the treatments and the medications that they're getting because it is now recognized, acknowledged in the name itself what is driving the symptoms. So if they're able to manage metabolic syndromes, if they're able to manage endocrine function, that is going to help improve and reduce the symptoms for those patients. So it's exciting, and it's a really exciting time to be a clinician in the pelvic health space. Um, and yeah, it's you mentioned my conference, the Pelvic Health Conference and Endometriosis Symposium, which was an amazing event that we had this year, but we've been having for many years in New York City. And we had so many clinicians who were all about like what is actually going to help people improve, what is going to help people feel better. And we talked about all of these overlapping health conditions. And that's why now I'm calling myself a chronic disease physical therapist, because these are chronic conditions that we're talking about and we're dealing with. And you, as a physical therapist, if you're working in the pelvic health space, this is actually probably an answer to one of your questions coming up.
Yeah.
You need to learn as much as you can about all these conditions. Yes, I can't give medications, I can't prescribe medications, but if you can understand what the symptoms are like for these patients, you're going to know how to properly refer out. And it's so important that you are doing that, referring out, so that people can get that other medical management so that it can help control the symptoms that might be manifesting like pelvic pain or might be manifesting like um, a fibromyalgia kind of symptom. So yeah, I went off on a tangent there. Bring me
I
back.
love that. No, this is great. I think that's, I think with the conversation about PCOS, now PMOS, I think a lot of terminology, and you kind of said this, is the labels that we gave these chronic conditions, this terminology oversimplified what the patient was experiencing.
Yeah.
And as you said, then it really impacts how a provider can treat them. Uh,
Yes.
and I've had plenty of friends, especially women, who at some point had a series of symptoms which were either somewhat simplified, misdiagnosed, kind of overseen, like, told it's not what you think it is. And I
Mhm.
think there's an element to that there where they would suggest we were like, is it PCOS? Is it whatever? And without a better understanding of what is really going on, the root cause, sometimes a doctor's going to miss it.
Totally. Absolutely. Yeah. So, I mean, the name makes it pretty straightforward.
Yeah.
Someone
So what do
presenting
you
like
think
this. Yeah. Uh-huh.
with the new name, with the metabolic kind of component to it? Something that you made a comment to me was, well, this is going to make it easier for us to explain why Winback would help this symptomology. So can you speak a little bit to that about how you're seeing like radio frequency helping with those symptoms now that we have a better handle on what that root cause is in the
Yeah.
name?
Totally. So because Winback, one of the impacts of using the radio frequency current is that impact on metabolism. So when we are using the current, depending on which electrode and which current we're using, we can be influencing cellular permeability. And when we're influencing cellular permeability on that level, we can be influencing metabolism or the trophic nature, the trophicity. Fred's going to be happy that I said that in this podcast. So
That's very-
trophicity. So the nutrition for the cells itself, we can influence that. And so if we're able to influence that on a cellular level, on a metabolism level, we can help reduce some of the symptoms that the patients are presenting with who have PMOS.
Yeah, that makes sense. What do you think? Do you think this is a sign that medicine, because I think we mentioned this earlier in our conversation, is that women's health conditions have been less focused on, perhaps we could say minimized or misunderstood to some extent. Do you think that things like this renaming, is a sign that medicine is moving towards a more systems-based understanding of women's health?
This name is definitely a signal that we are moving in the right direction and we're moving in a way of understanding the overlap of conditions and symptoms.
Yeah, I agree. And I think that's so exciting. I think this is why, as we said at the beginning, it's like women's health is trending. Well, it's also something that perhaps it's just it wasn't given the space it needed. And now
Yeah.
that we're getting a little bit more focus on it, frankly, I mean, this is perhaps a personal note, but I do think that it's as women become more prominent in the medical field, that we have there's more doctors, there's more PTs, there's more women
Mhm.
who are in these spaces. Of course, this is going to become more of a conversation because these are things that are very personal, and it's, you know, half of the population who's dealing with these kinds of conditions. And I mean, pelvic health in general also, of course, is not just women, but
Yeah,
there are certain conditions that are unique to our population.
absolutely. Totally.
So let's move from there. Kind of the last big topic that I want to jump is about the future, is about where we're going, both as a general future of women's health and rehab, and what you think, what excites you about the future of this space of chronic conditions and chronic health and how we're approaching it now.
Yeah, what excites me is that we have a more recognized understanding of overlapping health syndromes and overlapping syndromes in general. I had presented at my conference during the lunch hour about the FIGO IPPS pelvic pain categorization and how it acknowledged, which we as clinicians who were already working in the space for some time, we already knew this, but they put it beautifully in paper so that now future physicians who are going to be coming into pelvic health and newer physicians who are already in the space can have this understanding of, wow, look at all of these systems in our body that can be causing pelvic pain: reproductive, vascular, musculoskeletal, neurological, psychological influence, like all of these things, all of these systems in our body. And so I'm excited to be in pelvic health and to be in this space because this is something that, like I said, the clinicians who have already been in the space, we kind of knew this and we have seen this, but now it's like being said and acknowledged. And with that, we're just gonna help so many more people relieve their symptoms and get better because we are all on the same page that these things overlap. In the pelvis, the anatomy, it makes sense. If you have this small space with all of those organs, the visceral organs that are touching each other, I mean, hello, of course, with the anatomy being so close and touching, it's going to influence one another. And then we talk about orthopedic anatomy. I mean, I could go on and on, but I'm excited because we're in this moment where overlapping health conditions is acknowledged and we are going to help people more.
Yeah, I think that's a really good point, is that in general we've seen a shift in as we gain a better understanding of the systems-based approach in general, is that I think in a traditional, and it's interesting because you can tie in, obviously, as you've done some of your training and you've talked about osteopathic approaches and holistic approaches have always kind of historically been more systems based, like even Chinese medicine, right? It's all kind of built around that, or Eastern medicines. Whereas a more traditional Western medicine was like, you learn this one thing very well, you have your specialty, right? You refer to your different specialists who deal with that organ or that system. When the reality is it's not really what's going on in the body, right? Like our bodies don't work as
Yeah,
it, if you think of your body as like an office, it's not like every department is working by itself. Everything is cross-functional. It's all influencing. So
totally.
to have that perspective change in general in medicine, I think has been a really positive shift. Um, with that being said, for you as a PT, what role do you kind of see with like movement, rehab, and especially nervous system playing in the future of medicine?
Well, um, nervous system based manual therapy and nervous system based movement is going to and is already helping people because all of these chronic conditions, they impact our nervous system. So going at it from that angle is going to help people and also um, enhance the clinician's understanding of again that overlapping and the connecting systems. Um, yeah.
Yeah. Do you think, because obviously you're working with technology, but as we continue to build in this space, because as I mentioned with like when I spoke to Mark Shires, our sports ambassador, is like modalities have their ebbs and flows where sometimes it's more, people are using modalities more, sometimes they're not. I think right now energetic modalities are really kind of hot, like what we're doing with Takar,
Mhm.
laser, shockwave.
Mhm.
These are all harnessing different energies to work with
Yeah.
the body. What role do you kind of think that plays in the future of this space?
I I feel that, like I had mentioned when we talked about metabolism, specifically with the radio frequency current, that is going to become more popular and more widely used because it's getting down to that cellular level and it's also doing multi-system treatment. So when I'm using the current, if I'm using it, say, for like scar tissue in the abdomen, that current is also influencing cells, it's influencing the connective tissue, So I feel and I'm excited that TechR radio frequency, the Winback radio frequency currents are going to be more widely used because it is already addressing multiple systems at once.
Yeah.
So yeah, I'm excited for that.
Awesome. Okay, one final question, which is the fun one, which you alluded to earlier, which
Uh-huh.
is as we start to wrap up, what is a clinical hill that you will die on?
Okay, clinical hill that I'm gonna die on, meaning clinical hill that I like believe in strongly, um, is that anyone who's in the pelvic health space or wants to be a pelvic floor physical therapist, pelvic health physical therapist, needs to learn about other overlapping health conditions. You must learn about pelvic venous congestion syndrome. You must learn about POTS. You must learn about MCAS. You must learn about all of the overlap in syndromes because the symptoms are similar. And what we talked about in the very beginning about I was deciding, did I want to be a MD or go to PT school? Well, I am a physical therapist and I'm a musculoskeletal master, but I still need to learn as much as I can about all of these other medical conditions because we now know we're in this moment. You can't deny it. We must learn about these other conditions. We cannot just treat the muscles. We cannot just treat the ligaments, not just treat tendons, bones. We need to learn about the other systems in the body as much as we can because that is the future of pelvic health.
Love that. That's fantastic. Um, okay, well, that will wrap us up. So very quickly, Melanie, thank you so much for joining us and sharing your perspective, your experience. I loved hearing your story. It's just so cool to hear what got providers like yourself into the space and what's continuing to inspire you every day. I think these conversations are really important because they highlight, kind of the clinical side of what you're doing in the women's health space and chronic condition space, but also the human side, like the trust, the connection, educating both yourself and your patients and helping the patients feel heard and understood. Um, Before we wrap, is there anything you'd like to share, maybe about the endometriosis symposium or about your practice, for anyone who's interested in learning more?
Yeah, I mean, if you are a physical therapist who is really jived and excited about some of the things that I spoke about in this podcast, I would love to connect with you. We have a growing team in New York City, and yeah, would love to connect and talk. And if you're someone who works in the space of pelvic health, know that every March we will be having our annual pelvic health conference and endometriosis symposium in New York City. So feel free to follow me and stay tuned for that. And yeah. Thank you, Ramona.
Wonderful.
Thank you,
Uh,
Winback.
if someone wants to connect with you, what's the best way? Maybe a website, a social media handle,
Yeah.
LinkedIn.
Yeah. So I'm on LinkedIn, Dr. Melanie Carminati, and I'm also on Instagram at Dr. Melanie Carminati. I think it's dr. Melanie Carminati. So you can find me there. Feel free to message me there. And yeah.
All right, wonderful. Thank you, everyone, for listening to this episode of the Winback Academy podcast.
Love me.